Welcome to yet another video of MedServe. We are here to make you more delicate in learning and reading a chest X-ray. Surely this would help you to become a wise observer. This video series begins with the basic anatomy of structures in mediastinum and thoracic cavity. Let's get revised to the organs, bones and pleura, which is the right and left clavicle, 12 pairs of ribs, sternum, vertebral column, heart, and lungs. Diaphragm is present underneath the lung and the major vessels like superior vena cava, aorta with aortic notch. Lung is placed in right and left, where the right is divided into 3 lobes, upper lobe and middle lobe by horizontal fissure, the middle lobe and lower lobe is divided by oblique fissure. In case of left lung there is only 2 lobes, that is the upper lobe and lower lobe, which is separated by oblique fissure. Here is what normal chest X-ray looks like. It can be looked into first. Coming out is the systematic way of reading of X-ray can simplify things for you. Over the next few videos in coming weeks. Chest X-ray is done by 3 views. Anteroposterior view, AP view, which is mostly used. In AP view you could visualize only the upper and middle lobe of right lung and upper and a portion lower lobe of left lung. Lung area is represented by dark color. Getting in more detail about airway and lungs in chest X-ray one by one. Here is the trachea, this borderline marks it. Trachea is the tube that carries air from throat to lungs. Normally the trachea runs right down the middle of your throat behind your larynx. Any deviation in trachea gives us clue about any abnormality. It branches into right and left bronchi. Normally you see right more steeper comparing to the left. Next you see the lobes of both lungs, right lung with 3 lobes and with 2 fissures. Then when I'm assessing the lungs I also look at the pleura and diaphragm on both sides. The diaphragms should have a curved shape and sharp costophrenic angle. The angle present between the heart and diaphragm is called cardiophrenic angle. The right diaphragm should be higher than the left because of the liver. And on left sometimes you could see a gastric bubble underneath the left diaphragm, and in some X-rays colon air would also be present. If you look closely in lung field there are completely black, you will see fine strands of white in them over near to the edges. These are the pulmonary vascular markings and come in later when looking into pneumothorax or collapsed lung. Let's go over the bones next. I usually start with the clavicle, which is equidistant from trachea and it important in determining the rotation of the X-ray you are looking at. And you can see manubrium in each clavicle. Near to it you can see the scapula and humerus on the right and left side. Notice you don't see the scapula overlapping your lungs, that's because properly obtained thin films have scapula out off the lung fields so that layers of lung are not obstructed by scapula and soft tissue. The next set of bone is ribs. It would give us an idea that whether the patient had enough inspiration on X-ray obtaining to have the optimal view of the lungs. Lastly, for your bones, in the middle you will see the vertebrae and spinous process. You can even notice vertebra behind your heart, which signifies adequate penetration of the film. Finally, let's go for the heart. It typically lies left of the patient and it should be less than 50% of the thoracic diameter. Adjacent to the superior vena cava you can see the aortic arch. You can also see pulmonary vasculature spreading into the lungs. Next we can go for the chambers of the heart: right atrium, right ventricle, left atrium, left ventricle. So that's the basic view of anatomy of chest X-ray. Hence make sure you have subscribed to the channel so that you can get updates on new videos of